Well, thank you, Jason. Thanks for, AUPHA for hosting this session. It's been a long time tradition for CAHME to provide an annual update at the AUPHA annual meeting. We appreciate that even during these difficult times, AUPHA has continued this, and appreciate this opportunity to talk to the program directors and let you know what's happening at CAHME. Welcome to today's CAHME's update. Again, I'm Anthony Stanowski, the President and CEO of CAHME. As a reminder, if you have any questions, please use the chat area to comment, and we'll address those at the end of the session. And if you have any ideas that you'd like to share with me about anything that you see and hear directly, please email me at the address that's kind of shown on the slide. So the agenda today is going to provide some highlights of the past year, starting with our chair for the 2019-2020 year, Cindy Hahn. And then following Cindy, there will be a presentation of an update on the Standards Council and its important work on the next iteration of the CAHME standards. And that'll be done by Steve Szlowski. Paula Song will describe the process and the approach that we've done for our enhanced search tool and our enhanced program search tool. And we're really excited to bring that to our programs and to our students this year. Kevin Broom will introduce our new Core Learning Center, which replaces Bootcamp. And Kevin will kind of talk about some of the details around what the Core Learning Center involves and why we've kind of moved to that approach. And then we're going to end with Steve Ullman, who's going to share with you the results of the program director and site visitor surveys. Using this voice of the programs, we'll let you know how those comments really helped influence CAHME's strategies and directions for fiscal 2021 and beyond. So let's start with Cindy. Cindy, on a personal note, I want to thank you for all the work that you've done at CAHME over the past several years. And, you've continued well the 52-year history and tradition of the American College of Healthcare Executives with CAHME. I think, you've really upheld the finest traditions in there and appreciate your work in here. Thank you for your leadership the past year. So Cindy, let me turn it over to you to begin.
All right. Well, thanks, Anthony. And it has been a great year for CAHME, and this has been during an incredibly difficult period as well. I think the word agility really best describes CAHME in fiscal year 2020. So we thought we'd start with the mission statement and values, with the key part being we advance the quality of healthcare management education. Note how our mission statement is aligned with AUPHA's mission, which is to be recognized as the global leader in advancing higher education and scholarship in healthcare management and health policy. We have a great new relationship with AUPHA CEO Dan Gentry, and I think the future is bright for both of our organizations. As a corporate member, AUPHA plays an important role in CAHME. And if we go to the next slide, we'll see our corporate partners here. All of our corporate partners are listed. In addition to AUPHA on the top line are the two other corporate partners that have been with CAHME for 52 years, ACHE and AHA. Cedars-Sinai, MGMA, and Blue Cross and Blue Shield Association are also longtime corporate members. NEHQ joined CAHME in fiscal year 2020, and we're proud to welcome the Studer Community Institute as our newest corporate partner for fiscal 2021. We appreciate all the support that the corporate members provide to CAHME and the talent and direction that they lend to our boards, councils, and committees. Here you'll see more than the 250 people that volunteer their time at CAHME, or at least some of them here, whether it be through site visits, serving our committees, or rolling their sleeves up and helping us with projects. Our board members, Accreditation Council, and Standards Councils are listed. As you look through this list, you see many people you know from academia. Of course, everybody knows Dolores Clement, who is our board chair this year. We realize that many of you may not be as familiar with the practitioners on this list. Hospital CEOs like Don Avery at Fairview Park and Shelley Buck at Riddle Memorial, health system executives like Kurt Holman from Avera McKenna, and Annie Steelman at RWJ. We have senior executives from MGMA, ACHE, and Blue Cross and Blue Shield. We have the CEO of the Malcolm Baldrige Foundation, executives from leading integrated health systems such as CVS Aetna. We have an executive from one of the largest ACOs in the country. We have retired executives who represent Fortune 500 companies, large nonprofit charities, and regional healthcare systems and community hospitals. Our new board member, Quint Studer, is the CEO of an organization dedicated to community improvement, and of course was one of the leading voices for process improvement in healthcare through the Studer Group. Lastly, CAHME also has Executive Director of the Nevada Ballet, Roy Kaiser, on our board. This is a tremendous wealth of talent and knowledge leading our board and councils. CAHME has made a conscious and purposeful effort over the last 4 years to recruit racially and ethnically diverse members. As an example, nearly a third of the board members represent diverse race and ethnicities. Our gender representation is varied across the board and councils. Overall, diversity of thought and background is a goal of CAHME's board and council leadership. Other sponsors have helped with content creation and recognition of programs for pushing the boundaries for excellent scholarships and faculty grants. Look for information in late August on how to apply, but we've received commitment from all of our scholarship funders and from Canon Solutions America for the Sustainability Award, Peregrine Global Services for a new white paper on global competency assessment, and a new underwriter, Pristine Home Care, who will sponsor a new student essay contest. The number of accredited programs increased by 9 last year to 115. Notably, 5 years ago, CAHME accredited 83 programs. This chart shows what is called a pipeline report. CAHME is a growing, vibrant organization, and more programs are finding value in being CAHME accredited. While the number of new applications continue to be high, you can see how programs are progressing in terms of eligibility and candidacy. Just to note, for example, in the month of June, 6 new programs applied. For healthcare quality and safety, there are 7 certified programs and 3 that are part of the founding members. So let's look at that a little deeper. Healthcare quality and safety is CAHME's newest service line. You can see the founding members and the 7 certified programs who are also founding members. Importantly, as a pathway to accreditation, we are on track to have the first HQS accreditation site visits in the fall of 2021. While not compromising accreditation standards, our goal is to have the accreditation process minimize accreditation fatigue. One example is that we've partnered with AACSB to perform joint site visits. In fiscal year 2021, we'll be expanding with a project with Tulane and CEF. We streamlined the annual program report process and reduced the data collection to key statistics in an easier-to-use platform. As we have done every year over the past 4, CAHME shares our survey results with NCHL and AUPHA, so programs don't have to complete multiple surveys. Lastly, in November of last year, the board initiated a process of creating a policy around virtual site visits. In November, or rather in February, COVID hit, and we had to change quickly. So CAHME had been working toward implementing virtual site visits, and in November of 2019, the board approved a multi-year pilot study. However, coronavirus fast-tracked that into a reality. We quickly created a policy, and with board approval, 3 programs participated in virtual site visits this past spring. We used guidelines established by the U.S. Department of Education and Council on Higher Education Accreditation, or CHEA. We had learned from other accreditors who are a bit further along in the virtual site visits through the Association of Specialized and Professional Accreditors. And we discussed the approach with key stakeholders at CAHME. Given the time frame, we had to fast track the approach quickly. We implemented a technology to help us in the process, but mostly, and let me reinforce this, it was our site visit volunteers who worked with our programs to help us improve the site visit policies and procedures. And here's an important point. The program director survey results were positive and indicated their satisfaction with the approach. We also incorporated their recommendations and the recommendations of the site visitors to craft a new policy, which will be going first to the Accreditation Council and then to the board. Next, we had to move the boot camp to a virtual process to ensure that programs are getting the education they needed. Finally, CAHME reviewed CHIA and U.S. Department of Education guidance and ensured that the processes that the programs were taking allowed movement for residential programs online and allowed modifications of recruitment standards such as standardized testing. Our goal was to facilitate education during this time and not to be a barrier for success. So with that, let me next introduce Steve Sadowski. Steve Sadowski chaired our Standards Council last year and will be returning this year. Steve led the process to review and update our standards as required in the bylaws, a process that will now occur every 5 years. Steve is professor and graduate health administration program director at the University of Scranton. Steve, it's to you.
Thanks, Cindy. The Standards Council in the past fiscal year was focused on the examination of our standards and criteria. Importantly, most of the revisions were minor. The revised standards were vetted with the Accreditation Council and are now on our website, CAHME's website, for review and comment. It's important to note the standards go into effect for site visits occurring fall 2022 and beyond. Let me repeat that. The standards go into effect for fall 2022 site visits. This is really providing an overview of the proposed standards. We ask you that you go to the website to get the detailed standards and to provide comments to Eric Britko. I wrote his email address down here. It's ericbritko@cahme.org. The final proposed version of the standards will be presented to the board. So we went through a year-long process of reviewing our standards. We began back in the fall. 5 task forces of our Standards Council were created and assembled and focused on all of the criteria, as you can see. While these task forces looked at the criteria and standards, we did make edits in certain areas. We were not majorly altering the criteria and standards. This update does not have the time to cover the changes today. So this is where we're asking you to review the web page and please give comments to Eric Britko. Instead, let me just give you an example. As you can see, one of the changes is on 3A.6's interpretation of the competency requirements. We added transparency as a core part of the program curriculum. We will be altering the completion rate data in fall 2020 annual report and the self-study year documentation. Frankly, the completion rates was found to be inadequate in representing a program's outcomes. Historically, programs were asked to provide the percent of graduates who graduated in a normal or expected time frame for the program. And there are a couple of problems with this. The first, poor variation among the responses when reviewed with the explanation seemed to indicate that self-defined normal time period was the key element of variation, and note the metric. The graph shows that 93 programs reported meeting the standard or exceeding it. This is because the programs self-define normal time period. 2, part-time programs experience greater variation in times to complete the program, which attributed to the issues here also. Part-time programs self-define, it just didn't make sense for part-time programs. Number 3, our data showed while only 5 programs failed to meet the 80% standard, 1 was borderline and most programs met the standard. This appears to be good. However, when you look at most programs, almost 2/3 of the programs are at the highest percentile, which means very little variation. We also looked at how the programs who failed the standard responded, and we compared those responses to programs who met the standard and how they commented. Based on this qualitative and quantitative review, completion rate was determined to be an inaccurate measure to assess student success. The Standards Council proposed utilizing two metrics, which are based on metrics by the National Center for Education Services instead. The first one is time to graduate. And this is using a confidence interval analysis for graduating, for the graduating class in question. What is the median, what is the median 50th percentile in months to complete the program of study? What is the 80th percentile in months to complete the program of study? And then explain the variation between the median, the 80th percentile. Second, the retention rate. Of students admitted during the self-study year or annual report year, how many students continued enrollment past the first semester? This creates well-defined, statistically accurate, consistent data that is meaningful to students. It also eliminates the vagueness of normal. These measures serve to provide students a more accurate understanding of time to graduation. In particular, these measures will be important for students considering part-time programs. We will begin to use the new metrics this fall in 2019-2020 annual program report and going forward. Please, we welcome your comments at the end of this presentation or email to Eric Britko, as I mentioned earlier. For detail on the latest revisions to the standards, visit CAHME's website for more information. And again, Eric Britko for comment. So I appreciate your time. And next up is Paula Song. Let me introduce Paula Song. Paula led several of the task forces related to the public release of data. Paula was most recently with the University of North Carolina in Chapel Hill, but has just accepted the role of chair of the Department of Health Administration at Virginia Commonwealth University. Congratulations, Paula.
Thanks, Steve. Good afternoon. It's great to be with you all this afternoon. Thanks for taking time out of your day to be with us. So as Steve mentioned, I've been working with CAHME over the last several years on the release of the program data publicly, and in large part to keep in line with the requirements as defined by the Council of Higher Education Accreditation, or CHEA, under the guidelines of the U.S. Department of Education. So on the next slide, I wanted to just take a moment to provide a bit of history. So this journey started several years ago. Over the past 4 years, the task forces were assembled to review the benchmarking, the public release of data, and the annual survey report, starting in 2017 through 2019 and 2020. Based on this work of the task forces, the public release of data task force guided the release of the new search program tool in mid-June 2020. And really the goal of the tool was to provide greater transparency to students and also to facilitate quality improvement of our programs through the ability to benchmark. So the tool enables the general public, students, and employers in university-based programs to compare and evaluate the performance and outcomes of graduate programs in healthcare management education. So users can review a variety of program characteristics, a summary of the last accreditation site visit report, and 3 years of program-specific data, including program requirements, recruitment profiles, student and faculty demographics, starting salary, and placement information. The tool also provides a direct link to the program's website and information to key program contacts. Users can search across different parameters and compare up to 3 different programs in one view, and then drill down to a program profile, including 3 years of trending data. So the tool is accessible on CAHME's homepage, in the top right corner, search for accredited programs icon that is circled in red here on your screen. So the tool is really easy to use. And here you're seeing some screenshots of the tool. You can search across 3 different parameters. You can search by degree type, delivery mode, and region. And the tool also features a clickable map that enables you to search for programs by region. So after the search query is conducted, then users can view a list of programs that meet the selection, and then they can review degree, delivery mode, location, student body, and in-state tuition or tuition information. And then further, the user can decide which programs they want to compare. So up to 3 programs can be selected for comparison. And as you can see here for demonstration on your screen, we selected 3 programs across the top. And the user here can then compare the tuition, the recruitment data, the student body data, faculty and graduate demographics, including race, ethnicity, gender, and outcomes data featuring placement rates, median starting salary, and job placement data. So one program can then further be selected to drill down to the program profile page. So on the program profile page, users can compare program data for over 3 years, view the latest accreditation summary report, and link directly to the program's webpage. Programs also have the option to comment on the data, with directing students to a page that the program manages independently at their option on their site. And then a user can view the program comments. So already planning is underway for a version 2.0 of this tool, and CAHME will continue to build upon this platform to increase the robustness of the tool. And again, the goal of all of this is to really get better data to students, to enable them to help make better decisions, and get better data to programs to help improve performance. For more information on the tool, feel free to contact Jen Cernica at CAHME at the contact information provided here, and visit CAHME's website. The site includes a tutorial that further explains the features and functionality. And now I'd like to introduce Kevin Broom. So Kevin Broom chaired the CLC task force, and he was the main faculty for the CAHME Bootcamp. And most of you know Kevin from his role at the University of Pittsburgh as the Vice Chair for Education and Director of the MHA and MHA MBA programs.
Thank you very much, Paula. Appreciate it. So first, I guess the question is why did CAHME come up with the Learning Center, the CLC? We had actually been looking for ways to kind of leverage technology to enhance the bootcamp process, as well as to facilitate some of the site visitor training. So about a year ago, we began some of the initial discussions about using a learning management system to help achieve this. In particular, we wanted to focus on the bootcamp. It had been an incredibly successful program with growing enrollment. It was receiving very high satisfaction scores, and it was seen as essential for programs going through accreditation. But with that being said, COVID-19 really forced CAHME to an inflection point. We either had to cancel the boot camps with the in-person component, or we had to come up with some sort of another solution, which meant fully transitioning the boot camp to the Core Learning Center, which was what we did. So with the Core Learning Center, CAHME has created an innovative online subscription platform that enables users to access a library of essential CAHME content and resources that help you prepare for the accreditation process. So now we'll do a little bit of a deeper dive into how we work to develop the Core Learning Center and the type of content within the learning management system. So in working with consultants who are experts in online adult education, along with some technology experts, and then a task force of people like myself and like all of us of healthcare educators, we invested in the creation of the CAHME Learning Center. And the CLC transforms the boot camp into a completely online experience. And what it does is it eliminates travel expenses. It expands your access to content and provides the participants with the ability to review the materials based on your availability rather than trying to conform around the predetermined time that we had set up for the boot camps. So the content includes the accreditation education sessions. It also has site visitor modules and an expert practice area, and that's all designed to try and help programs be more successful in the accreditation process. We also integrated the CAHME Mentorship Circle webinar series into the service, and we're planning on adding some exclusive synchronous virtual events as well as some other bonus materials. So now that you have a little bit of better idea on why and how it was developed, let's discuss some of the featured content inside of it. The content is structured around a program leader's ability to improve their understanding of the accreditation criteria. And it also includes the industry-defining standards, best practices from leading programs, and descriptions of the accreditation process. The goal is to improve program quality and help programs be better prepared to meet the accreditation standards. So some of the categories of content included within the subscription area, you have Accreditation Basics, which is roughly the boot camp. So all of the material that reviews the CAHME criteria and the standards helps underscore which ones are the ones that tend to be most problematic and helps programs be successful in a very proactive way in going through the accreditation process. And it's designed to help programs that are both going through their initial accreditation as well as more established programs that are going through the reaccreditation process. So the accreditation basics portion of it really covers a lot of the content that's built into the boot camps. There's also a site visitor basic section of it where we have some modules that are designed to create some or to help improve inter-rater reliability. What we wanted to do is we wanted to try and take a lot of time and effort in making sure that whenever the site visit teams go out, all programs get a consistent evaluation from the teams, regardless of who's on the teams and whenever they come. So it was really about trying to improve the inter-rater reliability across the site visit teams that go out and conduct all of these site visits. There's also an expert perspective module where we're housing all of the CAHME Mentorship Circle series and other webinars. And then there's a CAHME chat section, which has some podcasts in it. And then we have some bonus content that we're going to be putting into the Learning Center as well. So we'll have more information to follow on that. So finally, the Learning Center brings about some cost savings for programs. And this was really the driving factor behind why we wanted to try and leverage technology. Cost was a concern for CAHME. And it was also a concern for all of the programs in particular. So what we did is we moved to the Core Learning Center to where that we have one comprehensive fee that allows programs to have up to 5 users at one university to have access to the system. So now instead of paying for one person to travel to the boot camp, you can now have one subscription that pays for up to 5 people to be able to access the system. So the content is available for 1 year under the subscription model. So that allows you a lot of ability and flexibility to be able to break up the content and spread it out over time and continue to go back and review it. There are pricing models, but what we're showing here is the one that pertains to most programs. Basically, for what would be less than the cost of sending one person to the boot camp, including all the travel expenses, you can now allow your team to be able to access the materials for a 1-year period. So CAHME, the Core Learning Center that CAHME's put into place is a huge cost savings, especially when programs want to send multiple people through the bootcamp process to learn about the accreditation process and about the standards to have you better positioned for success in the accreditation timeline. So if you'd like more information about the Core Learning Center, you can contact Melissa Cross. She's the education coordinator at CAHME. Her email address is mcross@cahme.org. So now that I've covered the Core Learning Center, I'll now hand it over to Steve Ullman. Steve was past chair at CAHME this past fiscal year in 2020, and he's returning to the board member role for 2021 as he completes his term on the board of directors. He's currently the department chair and professor of the health sector management and policy at the University of Miami in Coral Gables. Steve?
Hi, everybody. Thanks for joining us. It's always a pleasure to be with my colleagues, both that you see visually and all the colleagues out there in the audience. I've had the pleasure of being associated with CAHME and its predecessor, AUPHA, and the Association of University Programs in Health Administration, going back now about 40 years. One of my greatest joys is being on the board with such committed people, as you see on this session. I also was lucky enough to be the board chair before COVID-19. So my job was a little bit easier than Cindy in terms of what we have to all deal with. But again, I've been so impressed with how CAHME has pivoted in terms of working with some of the things that we're seeing. So if we can turn to the next slide, please. Thank you. So one of the things that's impressed me so much is, as a result of board leadership and our executive director, Anthony Stanowski, is whereas I saw basically linear improvement over the course of CAHME over the years, we've really had some exponential improvement over the last couple of years, a true reflection of leadership. We basically put into practice what we all teach in our programs, and that's the voice of the customer, if you will. In this case, our customer as our programs themselves, our program directors, and our site visitors, and listening to them, and then trying to implement methods to improve our processes to make sure that we were meeting the needs of our constituents. One of the results of that is something that you see in front of you right here, and that is from 2017, where we already had some very strong indication that program directors would recommend CAHME accreditation, 84%, and that they would pursue accreditation from CAHME again, 84%. You see that over 3 years and through implementing some of the things that you've been hearing about just over the last few minutes, we're now up to 96% of recommendation of CAHME accreditation, 98% indicating they would do it again. And as we all know, that is no small feat to be able to go through and successfully accomplish accreditation. So to hear that is quite remarkable. Next slide, please. Also, in terms of how program directors themselves rated what CAHME was doing, again, some significant improvement over the last few years, whereas in 2017, 13% rated it as fair in terms of what CAHME was providing to his program directors, 87% feeling that it was very good or good. We are now up to 100% of program directors who indicate that their perception of CAHME is that it is good or very good. I wish my students all could do as well as CAHME is doing in terms of those percentages. Next slide, please. So one of the things in terms of listening to what our programs are needing and wanting and how we can address some of those things and how we go forward over the next year, some of the processes you've already been hearing about, but in terms of going forward, trying to strengthen those initiatives. So one of the things we've heard is that the accreditation process, which is a relatively new process, is not as user-friendly as we perhaps like. And so therefore, we find that our staff and our executive director are looking at different platforms to figure out where we would take this and where we can improve this process. Next slide, please. One of the things you've also heard is something that has been incorporated into the Core Learning Center, and that is the concept of providing some training, additional training and education for our site visitors. For those of us who've done site visits or have been site visited by site visitors, we realize that there's a little bit of variation in terms of how site visitors look at different programs. And so we'd like to create better consistency, better inter-rater reliability. So in terms of that, what we're now asking our programs to do is to rate their site visitors, to indicate that what they're getting from the site visitors is indeed, if you will, constructive criticism, ways to improve their programs, because that's ultimately what we want to see with our programs. And to make sure that if we had one set of site visitors visiting us if the next site visitors were to visit us, they would be relatively consistent in terms of what they were finding by reviewing our programs. So again, this is something that will be now incorporated into the core learning center that my colleague Kevin spoke about. And then also because there is a lot of work that goes into doing site visits, I know that personally, that there will be now a recognition program for those who have been on those site visits. To say this is no easy task. We do thank you for putting in the time and energy and the training to do these effectively. Next slide, please. We realized that when going through accreditation, those of us who have done it, most of us in this virtual room who have done it, that again, it's a lot of work. And so the board and our executive director have been looking at ways to basically streamline and work with other accrediting bodies that are basically saying that the umbrella organization of our universities, such as AACSB or CEF, when they are accrediting the universities, that's already giving some indication of some base accreditation that's been accomplished by our programs. And now to build on that in terms of what we do specifically in our programs. So I had the pleasure of being on the beta site visit for Baylor University with their AACSB dual visit, where the site visit went CAHME were together with the AACSB visitors. And by meeting the AACSB criteria, we now could have just the criteria focused on CAHME that could be reflected upon, made it much easier for the university going through accreditation and much easier indeed for the site visitors as well. And a true collegial relationship with AACSB. We're now, as you heard, going to be doing that similarly with CEF, with Tulane University being the beta tester for that, with a pilot dual visit, which we perceive, if these go forward, can continue to make the job of going through accreditation processes and reaccreditation processes much more streamlined and much more effective. And so we will be seeing these also site visits going virtual. This was something already in the planning stages before COVID, and COVID basically just being one more little pull or push to basically move more toward virtual site visits to make life easier for the programs and the site visitors themselves. Next slide, please. We want to make sure that we're meeting the needs also of our program directors. So CAHME itself has strongly strengthened its support staff with 4 part-time staff members that have been added to our methodology. We then also do some contracting out for services that we do not need to use internally, but create more cost efficiency. Most of you know that we have brought Eric Brito back into the fold, who has been phenomenal as a support person for the accreditation processes. We're so pleased to have him back. And then also we have brought in administrative residents who actually work with CAHME in terms of the management processes. A win-win, CAHME getting some good, cost-effective staffing, and that administrative resident gaining much in terms of his or her work with CAHME. Next slide, please. That we're also working much more closely with our colleagues at AUPHA. It's been a joy to have Dan Chantry now leading AUPHA. I've known Dan for years. He's worked with CAHME has worked with him. And so to have him as CEO, we just see this as a relationship just flourishing going forward. And similarly, with the relatively new relationship with the National Association for Healthcare Quality, and that partnership, we perceive that that will be something that goes forward and aligns with our healthcare quality survey initiative. And finally, in terms of this, we are looking at all of our accredited programs, our online programs, looking at how we can enhance our benchmarking with our new mandatory enhanced benchmarking program. that you have heard about our search capabilities, which I assure you, from my perspective, is phenomenal, because I will be using this with my students as they look for programs at the graduate level and CAHME accredited programs. And then as we go forward, our ongoing communication back and forth. With that, we just continue to look at making our lives better, our program lives better, our site visitor lives better as we go forward, and truly making CAHME a premier accrediting body in this country. And with that, next slide. There it is. We really welcome your questions and see if we have some of the answers for those questions. With that, I do give it back to Anthony Stanowski, our wonderful executive director.
Thank you. Thanks for those nice words. It's been an incredible process of working with the boards, our councils, our committees, our volunteers, our site visitors, and bringing this organization to kind of new heights in trying to meet our mission. So with that, I'll leave it open right now for some questions. I'm looking on the chat window right now, and let me see some of the questions that are coming up.
Anthony, I have not seen anything coming yet, but just as a reminder to the attendees, feel free to put your questions into the chat or the Q&A. And Anthony, if you don't mind, if people raise their hands, we can also unmute their mics if they wanted to ask personally as well.
Great, thank you. Steve, there's a question about the Standards Council. Could you talk about, how that process kind of occurred with the 5 different task forces? Steve Cisłowski.
Sure. So thank you for the question. So back in November, well, I should say October of 2019, we broke into 5 task forces, members of the Standards Council, and including and ensuring that both practitioners and academics were assigned to each of the task forces. What I've asked each of the task forces to do is to take a thorough review of the standards and criteria and interpretation of them. In doing that, we used our external environmental scanning reports, our SWOT analysis, and other secondary reports and benchmarking reports to see where perhaps some of the challenges or issues that programs are facing. And that's resulted primarily in clarifying and refining some of the interpretation, more so than changing any of the criteria or standards. So each of the task forces then reported back out in January, and we summarized and vetted those modifications and observations that were made. We then made in April a draft report of the modifications and recommendations. They were reviewed, discussed with the board, but we did not, we did not get a motion for approval or anything at that point. That's forthcoming, but we did put it in front of the Accreditation Council and received their comments, which are included in what's posted on CAHME's website. At this point, what we're looking for, the Standards Council is looking for, is comments and feedback from our stakeholders and program directors, faculty, and other key stakeholders through the summer here. So if you can really take a look at those, if there's something we could clarify or perhaps refine. Our intention here is to really look at getting a final set of standards drafted into the upcoming fall, and eventually get a approval from the board, and that would be forthcoming. So we use secondary reports, we use primary observation from the task forces to come up with the modifications.
Steve, thank you. It's having sitting on those meetings of the council, it is really impressive, the commitment of both the academics and the practitioners in there, including some CEOs of major hospitals, health systems, the CEO of the Baldrige Foundation, folks from an accountable care organization, long-term care, all participating to ensure that the students are well prepared to lead. So thanks for that overview. The next question I want to direct to another Steve Ullman. Steve, as you know, is from the University of Miami, the MBA program, and several years ago went through the first joint site visit with the MBA, AACSB, and CAHME with the health management. This question was, can you explain what the joint site visit with AACSB means?
Sure. Again, as mentioned, we are a business school-based program. We went through CAHME site visit a year ago without the opportunity to work with AACSB. And we all know the amount of work for business school-based programs. Watching the one we just did, successful one we did as a site visitor, going to another business school-based program, the ease of working with AACSB was just wonderful. What happens now is that I would say about half of the criteria that are part of our methodology with CAHME are already basically satisfied by AACSB. So for example, if we're looking at PQ, faculty, that's reported out already with resumes, et cetera, to AACSB. So why reinvent the wheel as you're going through CAHME accreditation? Things like library provisions, things like space. A lot of the criteria that we have required as part of CAHME accreditation are actually met by AACSB. So we were basically looking now and Baylor University was able to do this, basically say, okay, here are the things that we're doing for AACSB, and we at CAHME can say, yep. Now let's just focus on the healthcare focus aspects of this program, making life much easier for the program, honestly making life easier for the site visitors, and then again, a very collegial relationship that existed between the AACSB and the CAHME site visitors. By the way, Eric Brito is listening in, and Eric can help if you have any specific questions about how one can go forward with this and the criteria specifically that transfer from AACSB to the CAHME accreditation. Eric will be more than happy to help you, as he helped all of us on that site visit that we did.
Thanks, Steve. And if anyone is interested, please send an email to Eric. He can send to you kind of the policies and approach of how we kind of work with AACSB and kind of make that process easier. Not the standards, the CAHME standards or criteria easier, but the process easier. Yeah. The next question came from Chris Calkins at Penn State. Chris asked, can we give an update on plans for site visits in the fall and in the spring, virtual, in-person, and hybrid? So let me take a crack at that question. When COVID came in, we very quickly put together a policy based off of what other accreditors who've done virtual site visits have done, some of the work that we had done in preparation for creating a pilot study for it, and then in consultation with a couple of key academic and practitioner executives, including Dan Gentry at AUPHA. And we got some input in that very quickly. We didn't get a comprehensive set of input, but we got quick input on it. And we went to the executive committee of the board to approve it. The policy was designed to be a one-year policy that would start with the spring visits and would end in December 30th, 2020. That policy was designed in such a way that we would be able to conduct our site visits, albeit virtually, in the spring and in the fall as well. COVID has not taken a breather. In fact, it's accelerated in almost the entire parts of the country. And we know that in the fall, we will not be doing any on-site visits in the fall. We will not be doing any on-site visits in the fall. All visits, both to new programs and to reaccredited programs, will be done virtually. We have a policy that will be going to the board in the fall that is expanded on the additional policy we had, and that policy kind of uses additional information we received from additional accreditors, uses additional information that we got from our site visitors and from our programs, and has incorporated that into a more robust policy. We'll be bringing that to the board in the fall with an expansion. What we think we'll be monitoring the environment, but we expect COVID and virtual site visits to kind of continue into the spring at this particular point, if I were to bet on this. Whether virtual remains something permanent or whether it remains something that could be optional is not the question right now for us. The question for CAHME, CAHME's management, CAHME's board is, what do we need to do to ensure that our programs can be reviewed and site visits can be conducted? And over the next 6 months and maybe through the spring of 2021, virtual site visits will be the way that we'll be moving. You're welcome, Chris. Any other questions for other speakers?
Anthony, there's one question in the Q&A from Maureen Jones. Can the AASCB report be made available in advance to CAHME site teams?
Great question. Appreciate that, Maureen. Yes, we've worked with AACSB, and I've had some great conversations with their executive team. We're working out very formal processes with AACSB at this point. Yes, the site visit report will be made available to the CAHME team, and we've kind of agreed on that process. So yes, there was a slight issue, not with Baylor, where we were both on at the same time, but at another program that followed Baylor, we were doing it jointly, where AACSB was a couple weeks earlier, and we had a little bit of an issue with it, but we won't have that issue anymore in the future. Another question with regard to the virtual site visits: is there a written set of policies and practices to follow? I will be a team leader this fall and need some specific direction on how to organize the visit. Thanks, Allison, for your question. Yes, we have created a new virtual site visit policy. We have run that through a smaller group of people at this point. The Accreditation Council reviewed it at the last meeting and made some suggestions and edits. We will be bringing that policy to the board in the fall. But we will also be sharing that policy with the site visitors moving forward, and that policy document should be available shortly. Yeah, so we're near the top of the hour. I think, Jason, again, I appreciate all of the board members' time on this call and all of the CAHME volunteers who've kind of participated in this process too, who've kind of helped make some of these initiatives happen. It's been a really amazing year. As Cindy said, agility is kind of the key word kind of moving forward, but we want to continue to make a difference and kind of help the programs along in meeting the high standards of healthcare management education. So with that, Jason, again, thank you for our panel for participating, and thank you for AUPHA for hosting this session.